A return to normality has brought with it a resurgence of nasty childhood viruses like flu, RSV, strep, and COVID, to name just a few, that had been kept at bay with mask wearing, social distancing, and school closures. Experts say that given the high number of infection rates, a child could be sick with multiple viruses. Pediatrician Dr. Stephen Kenny from Edgewood Pediatrics weighs in on what he's seeing on island.
There's good data on children entering school for the first time. So be that their first year in school or their first year in daycare, but their first year in a classroom with a large number of other children. You can expect a typical child, normal child, no diseases, healthy immune system, to catch 12 to 15 respiratory illnesses their first year. Yeah,
12
it's
to
a lot.
15 a year?
Yeah, and some of those are mild little ones, a runny nose, a cough for a couple of days, and they get over it. But those 12 to 15 tend to be clustered in the wintertime. And so you get one and it lasts a week, and then a week later you get another one and another one and another one. And it adds up to feeling like your child has been sick for 3 or 4 months. So we're seeing a lot of influenza at the moment. We're seeing probably 4 or 5 cases a day in our office, maybe more. And I know the hospital's seeing that as well. What's been fortunate in that regard, though, is that the children who've been vaccinated and their parents are not seeming to catch it. So the flu vaccine this year has been on the money and really provided good, robust protection.
Concerns over RSV has also been in the media, triggering more concerns for parents.
RSV is an interesting one. There's been a lot, it's been in the news a lot, and I've had a lot of parents really worried about it. It's a very common virus. RSV stands for respiratory syncytial virus. It causes a phenomenon called bronchiolitis, which is a viral infection in the chest, a little bit different from bronchitis. And it can be a dangerous illness for infants, particularly infants under a year or especially under 6 months and premature babies. And some of them do get seriously ill with it, but the majority of children, certainly children over 12 months old, it's just a straightforward cold, fairly unremarkable. I'm not sure why it has received so much press this year. We did have a little bit of an outbreak of it back in sort of October, and it seems to have waned now.